So that mucus is there for lubrication, and with sexual excitement, there should be more, but that doesn't always work that way, especially if you're pregnant, breastfeeding, on like hormonal contraceptions can change your ability to make your own lubricant. So using some type of lubricant, typically in the medical world, we recommend something called Astroglide, which is better than something like KY. KY is more of a medical lubricant, meaning it's to lubricate like a speculum or a vaginal probe, so it's like a one in, one out. And with friction, KY can become sticky, so that kind of defeats the purpose. KY jelly, right? So things like, there's one called the Astroglide over the counter that we really recommend. You can order on Amazon. You can actually order a 12-ounce bottle on Amazon. I ordered that for a friend that's getting married, because I'm like, girl, you're gonna need this, okay? So it's a great option as well. So think about lubrication typically as well.
And hot tour, that ain't it. That ain't it.
Pain versus discomfort. Okay, discomfort would be, this would be better in a different way, different position, different size. Pain is, I would consider, like, I'm not doing this again. And here's the crazy thing, especially about vaginas. I mean, listen, I'm a fan of vaginas, okay? They're amazing. But they have these little muscles around it, what's called the introitus, the opening of the vagina. And if you've had a painful sexual experience before, there is a psychological component to that. So then you begin to get what's called vaginismus. So it's a contraction of those muscles, and then like literally like knocking on the door but can't get in kind of situation, right? And then so then that potentiates more discomfort and more pain, and then we're just like, this is not going to work. So we want sex to be satisfying. So there are tricks around that. Time, foreplay, maybe a nice glass of wine, depending on your preference, right? Just to help kind of like relax you. I'm a big fan of lube and a little bit of wine. Okay, it can really just change. And they've said it before, and I'm a big fan of this. If you can't have a conversation with someone, you probably shouldn't be having sex with them. Like, if we are going to share our bodies in that way, we need to be able to talk about it. So I know it's awkward, but I think I'm a big fan of that. If we can't say, hey, this hurts in this way, can we try this? I need a little bit more here, a little bit more there, whatever that is for you, be able to communicate that.
Yeah, foreplay. Water-based lubricants as well. Like baby oil and petroleum jelly do not work with latex-based condoms.
Okay. Thank you all so much. Okay, how do you know if you're doing it right?
You know. You know. Yeah, because it feels good. There may be a connection, but definitely it feels good, and the other person seems to be having a really good time too. Okay. Anybody else want to add to that? Okay. Yes. Yes, there's absolutely wrong ways. Yeah, there's wrong ways. And you should know when that happens too, like owl not there, or other things that may happen.
For sure. Okay, so I just want to pause and we'll do a drawing for another door prize. But before we do that, here's a friendly reminder. Please, if you don't mind, folding up your question and holding it up so that they can see that there are questions to be asked, if you don't mind. Hold your glow stick up if you have a question. That'd be great. Okay, drum roll, please. All right. What's the number? It is 5339. 5339, who is it? Woohoo! We're over here. Keep your hand up.
Wave your glow stick.
Woo! Glow stick. Wave your glow stick. Yeah! Did we get it? Yeah, nice. Everybody give a round of applause. Woo! Okay. All right. Next question, should you choose to answer it, is I am a believer in aftercare. How can I make it better to take care of her?
Okay, are you saying like after sex? Is that what they're saying? Here, how about you answer, and I'm gonna.
Urinate, both men and women should urinate after sex, if that's what we're talking about aftercare. Now, if we're talking about like the afterglow, fucking cuddle. Cuddle it out. Cuddle lots if that's what you're into. But then, yeah, other than if we're talking about aftercare, urination, if there's been lots of lube, get the sticky off. I think that's a good thing.
Sorry, I didn't understand the question. Yes, especially for women, your urethra is about 1.5 inches long, whereas a male urethra depends, right? But probably a lot longer than that. So the risk of bacterial infections like UTIs are much more common in women, especially with things like oral sex, because our mouths are just dirty, right? So typically oral sex is performed around like the clitoris area, which is next door neighbors with your urethra. So it's very common for that to happen. So yes, urinating afterwards is a good thing. I feel like this is a great time to insert, like, to make sure that you are, that you've been tested, that your partner's been tested, that we're not ping-ponging STDs back and forth, because like that's not romantic or a turn-on in any way. They also, especially certain things like gonorrhea, is very hard to treat nowadays. It has a lot of antibiotic resistance, and if we can catch it early, we can treat differently and quicker than if we wait until that bacteria has kind of taken hold. So do not wait till you have symptoms. Like, for instance, in Lubbock County, chlamydia is a huge deal, okay? I don't have the stats on Hockley County, but it's probably similar, right? But 70% of people that test positive for chlamydia have no symptoms. So I would say don't wait. The standard from the CDC is if you are sexually active, you should be getting STD testing every 6 months or every time you add a new partner. So that gives you a little bit of details.
Okay, I don't want to be the buzzkill in the room, but I'm going to answer it like a parent would, because I'm a parent of college students. Some of your aftercare begins before you make the decision to have sex, and remembering that anytime a penis goes in a vagina, you could get pregnant with a baby. And if that is not something you want, would you say some of your aftercare is considering ahead of time, A, what your boundary is going to be, and B, protecting yourself and your partner from risks that you are not wanting to jump into. So when we talked about STD testing, I'm talking about avoiding pregnancy. A couple of things. First thing is, if you are loving yourself, make sure you're washing equipment properly as well, because you can also have bacteria transmitted and things like that. So second thing is from an emotional aspect. So whether or not you're having fun and it's a fling, sex is vulnerable and emotional. And so part of aftercare is taking care of your emotions after and checking in with yourself and your partner regarding how you feel about that. We talked earlier about how sometimes it's okay and you feel like, yes, I'm ready for sex, and then something might happen and that consent might change. And that's that vulnerability piece that you need to check in with yourself and your partner and be open and honest to. I thought this was right and good for me right now, but it's not. And so I have to take a check-in with my emotional and mental state as well.
Not douching. Not douching. That a whole pH, the vagina is an amazing structure. It is that's exactly what I was saying. Self-cleaning. Thank you. Same page. So yeah, self-cleaning, right? And then, okay, so vaginal, great. Anal, up to you. Vaginal then anal, okay. Anal then vaginal, no. Lots of bacteria, lots of infection, bad juju.
Okay, thank you all so much. Okay, next question. Is it wrong to not want to have sex at all?
Hard no. I think we talked about consent. I think we've covered that one too. So, unless somebody else has anything else.
think that goes back to, you know, a part of identity too, asexual being an identity and not wanting that physical sexual connection with another person. That's perfectly normal.
And asexuality is a whole cluster of identities. And one of those being demisexual, which means that someone is not really into sex. They're not going to be there until they have that strong emotional connection. And there's lots of people that feel like that. So you can be heterosexual and demisexual as well.
Okay, thanks so much. Can you still get pregnant from pre-cum?
Not technically pre-cum, but if there are sperm still in the canal, because sperm can live for a while. So the pre-cum does, like the fluid itself does not have sperm, but if there's any sperm, like there's been ejaculation previously, and there's any sperm left in the tube, right, in the piping of the penis, then it can occur. Do you want to add anything to that?
Oh.
So I'm a nurse, so I'm very research based. There is quite a few studies from in urology journals that show that there can be live mobile sperm at the end of the penis with sexual excitement. Okay, so there's a lot of variables to that. Okay, the other thing I would say is anytime we start talking about pre-cum, we start talking about the pull-out method, which the joke in the STD pregnancy world is, you know what you call a man that uses the pull-out method as a form of birth control? Daddy, right? Okay, theoretically you think it should work, right? But it fails about 40% of the time. Okay, so if I said, hey, let's all get on this plane and it has a 40% chance of crashing, not many of us are gonna stay on it, right? It is a risky choice, especially and I deal with high schoolers, okay? Like, they shoot before they even, it's like just barely get close, right? So it takes time to know your body, know when that's about to happen. So I would say that is not a reliable method of contraception as a young adult.
Awesome, thanks so much. Okay, next question, we're gonna pass to Nick. What if I'm afraid I got a girl pregnant, but I don't know how to ask her to get a test? Can we talk about the legal side of that?
So prior to birth of a child, that's a very difficult thing legally to have someone do because there's just a lot of unknowns there of curiosity of, do you know that person's pregnant? Do you know that could be your child? But we come back to what we've talked about before of if you can't communicate with somebody, you probably shouldn't be having sex with them. So that's something that you can not necessarily plan for, but have an idea of how to approach ahead of time, that you should be comfortable enough with a person to have a real conversation with them if you've gone to that level with them. So as far as just asking them, be honest and communicate and tell them that why you're concerned about that there are some factors that lead you to believe that's a possibility, and you think that that's something that she should do for her safety, for the safety of the child, for just everything involved in that. And then on a legal side of that, this gets a little bit more into family law than criminal law. However, there are a lot of protections for both father and mother of a child. And so research that a little bit with what paternal rights are as well, because that's important.
I just want to talk about resources for a little bit. So it's a scary thing. Pregnancy scares are scary. Thinking that you might have a child is a terrifying thing. And so not knowing where to go can prevent people from addressing it, right? And like if we ignore the possibility that I could be pregnant because I've had sex, because it's a terrifying thought. But there's a ton of resources on campus and in our community for you. There's pregnancy testing, there's resources if you are pregnant. So it's important to talk to your partner too and say, if this is the case, we do have resources. Do you guys want to talk a little bit about those?
So at Park Ridge, we offer free pregnancy tests, and if your pregnancy test is positive, you will meet with a nurse regardless. You will meet with a nurse, they'll run your pregnancy test. We are a licensed functioning medical clinic, that all those services are free. Also, if you are pregnant, they can offer you options counseling, because there are options to pregnancy, and you need to be aware of what those options are. There is no easy way out of a pregnancy. Okay, so every decision, we're talking, abortion, adoption, or what we call parenting, continuing the pregnancy and raising the child yourself. Those are all hard choices. They all have risk, they all have consequences. So the one thing you can't do is ever go back and not have ever been pregnant. Like we can end the pregnancy, right? Or we don't at Park Ridge, but I know that's an option available to you. Texas laws are crazy. Right now, we've got a lot of crazy things going on. There's a lot of misunderstanding and misconception. So you need to meet with someone who knows the ins and outs of those options for you. And then the most important thing with early pregnancy is dating the pregnancy. We like to think we can date it based on your last menstrual period. That's not always accurate. So an ultrasound is the gold standard in dating the pregnancy. That's about a $600 procedure. Park Ridge does those for free if you do have a positive test. So that's a great option. They do offer, they have licensed professional counselors on staff too. They can help with any other issues that might be going on. Speaking of paternal rights, the burden of proof in Texas is on the guy. It is not the girl's job to follow up and let you know. Okay, so you have the right to ask, but you don't have the right to tell her what to do. So that's just how it goes. Now you can get attorneys involved and require paternity testing and that sort of thing, but you can't come back 6 or 8 years later when it was your job to follow up on sexual encounters and make sure a child didn't result. That's basically how the law is written in a nutshell. Yes? Okay. So the burden of proof is not on the woman in that situation.
All right. Thank you all so much. I appreciate it. Do we want to drum roll, please, for a door prize? Who is it? Who is it? Who is it? Last 4 numbers are 5358. 5358. Who is it? Show your glow stick. Who is it? We found him? 5358. No one? Draw again. Interesting. Plot twist. Drum roll, please. Drum roll, please. Who is it? 5342. Woo! Nice, congratulations. All right, what'd you get? What'd you get? Nice. Okay. All right, next question. What do I do if I heard about or saw a sexual assault?
So, if you have heard about or witnessed a sexual assault, first of all, if someone has come to you and expressed to you that they may be the victim of a sexual assault, that whole innocent until proven guilty thing, that's for a court. Okay, that's not for us. We are here to believe people and to help them through this situation. And sometimes the best way to do that is just be an advocate and let them know. A lot of times somebody would say, hey, I gotta tell you something and I don't want you to tell anybody. It may be important for you to let them know before you go further, I'm here for you and for your safety. And there are some things that if you tell me, I may have to report. Especially if you are a mandated reporter for whatever reason. Some of us on campus are mandated reporters for certain things, and you may have that role. That being said, the most important thing for you and this person who's come to you is be an advocate, be their champion. And then second of all, from a legal standpoint, work with that person and let them know that they're not required to report anything to get the resources that they need for this situation. Just because they've gone to a hospital and had a sexual assault exam performed, or just because they've gone to get resources from legal aid or from the campus resources that they have or the health and wellness department, that does not mean at any point that they're going to be required to file a police report. So a lot of times they're afraid to come forward to get that help because they think this is going to be something where I'm going to be required to testify or to start a report, and that is not the case. Those resources are available for free without the need to file that. That being said, some of those things are really, really important to get started, such as the sexual assault examination to be done at the hospital, because I believe we're up to 120 hours. Earlier the better, but we have a 120-hour window in order to collect that evidence, and that evidence has to be maintained for 5 years, so that if that decision is made later that they do want to file a police report, they'll have that evidence collected and available. And in the meantime, they'll have the resources they need, like we talked about earlier, of making sure that they're empowered and they have a voice, and that this healing process moves forward in the best way for them. So that's the best thing that I think you can do for someone. So the question there, or the topic there, was to speak about if you were aware of a sexual assault occurring in a given moment. In that moment, that is a very dangerous situation, and the best thing you can do is to report that immediately. Please do that when safe to do so. Kicking in a door and telling someone to stop may not be a safe thing to do, but it may be the only thing you can do to save someone's life in a situation. So unfortunately, you are going to have to make a judgment call on what is safest thing to do in this moment, but figure out the safest way to make sure that that is reported so that we can get somebody help, because this is not an after-the-fact situation in which we're trying to make sure we're making somebody's voice heard. This is a situation and we're trying to prevent further harm, or prevent harm that hasn't happened yet. So when I said we always want to make sure we're doing what's right for that person as their method of healing and moving forward, in an incident that's unfolding, I think that we have a moral duty to protect each other, to make sure that they get immediate help so that we don't have further harm.
I do want to mention that there is a way to report anonymously through our South Plains College website. You can go to Care Team and submit a report if you do feel like you've been a victim or someone you know has been a victim of sexual assault, and then we have investigators that then reach out to help that student. I want to talk a little bit about what Nick said about mandatory reporting. I just want to clarify that our counselors on campus, we maintain a client confidentiality. So if you come to us and you report a sexual assault, we do not report that to anybody. That stays in our office, and it's something that we discuss, and then should you wish to take it further, we'll guide you through that. I just want you to know that our office is a confidential space.
Park Ridge and clinics like ours are also confidential spaces. When you enter into with a healthcare worker, there's a duty there, something called HIPAA. You can go to prison for sharing things. Now, if it's a minor, that gets into a whole nother ball of wax. I typically, like he said, preface my conversations with patients that I want you to tell me everything. What you tell me is private and confidential, but if you tell me something that puts yourself or someone at risk, I am legally obligated to report it. I don't tell you that because I want you to not tell me, but I want you to feel like you're in control here. Like I'm not your new abuser, right? I want you to know a clear communication and boundaries with our relationship. But if you're of age and you were sexually assaulted, we don't report that. We might try to encourage you to do that and go with you or help you make the phone call, but we do not legally report that either.
So much. All right, so next question. Are there home remedies for UTIs or ways I can get rid of it because I am too broke for the doctor?
Water is your best friend, okay? Flush that out. There are also, if it's a true UTI, it needs antibiotics. So I would say just watch and make sure you're not progressing into what we call CVA tenderness or upper back pain, because a UTI can become what we call pyelonephritis or a kidney infection. Those are very serious. So lots of fluid, lots. There's like cranberry juice. They say that it works. You would have to drink like a crap ton. It really just making your urine more acidic is not a great environment for bacteria. But lots of fluid, try to flush it out. But I mean, you could also go to the ER. They have to see you. You get a big bill, but they have to see you. So that's another option. I don't know about your resources here at school.
Yeah, and so part of our health and wellness is that we do have an on-site health clinic with a nurse practitioner. So as a student in 6 or more hours, that's free for you to use. We also partner with our local pharmacies to provide discounted, often free prescriptions to you as a student. If you're not in 6 or more hours, we also partner with South Plains Rural Health to provide sliding scale resources for the clinic and prescriptions for our students.
Awesome. Thank you all so much. Let's pause for another drawing. Drum roll, please. Who is it? Who is it? Suspense, the suspense. All right. It is 5372. Who is it? Who is it? Anybody?
Yes, this table doesn't get everything.
Funny. All right. Next question. Does something happen to someone who lies about a sexual assault or a rape case?
So yes, so legally we call that a false report. So if there is a lie that has been made about a sexual assault, the way that unfolds is we have an investigation. I won't go into the weeds on that because I could stay here all day. But a lot of people are afraid to report because of that. Nobody will believe me. What if there's not enough evidence? And I'm here to tell you it takes a lot to unfound a report, which means we're claiming that this was just a complete falsity. Just because there's not enough evidence to convict doesn't mean that there's going to be charges of a false report. That being said, if there is evidence to the contrary, which we've had cases before in which during interviews, perhaps there's phone evidence, communication that's happened that has indicated that this incident did not happen, that there was no sexual activity that occurred at all, or that there is some indication that there was consent that was never withdrawn but then later lied about. In those cases where we have evidence of a false report, yes, there are penalties for a person filing that report. You can get criminal charges for that. So if you are wanting some kind of outcome for an incident that has happened, please come forward without the fear that you're going to get in trouble for a false report. But if the question is based on is there some kind of reciprocity for someone just making an outrageous claim, it's important to know that we see a lot of that in the media, of people making these stories up. It doesn't really happen outside of very high-profile cases where there's some benefit to that. I mean, think about that. Why does somebody want to go through the pain and the heartache of getting that process complete for a sexual assault when it is a grueling, painful process to go through? Nobody wants to drag themselves through the mud. Nobody wants to be publicized in that way. And so it is a very, very low percentage of cases that are proven unfounded unless it's, like I said, some Hollywood crazy case. So please don't look at that and think, well, people are just reporting things to get revenge on somebody or to bring somebody down. That just really doesn't happen on that level.
Awesome. Thanks so much. Next question, if we're ready for it, is double wrapping safe?
No, absolutely not. Not at all. If you want them to break, that's one of the best ways to do it. You also do not double up with an internal and an external condom, right? So male condoms, female condoms, pick one.
Next question. Is it normal for the vagina to smell bad?
what is bad. If there's an unpleasant odor, and that's particularly an unusual odor, then you need to go get checked out, right? So if there's, but vaginas smell, penises smell too, right? We all need to take showers, but we'll let you go first.
So the signs of a STD, which I'm assuming is what we're asking here, a change in vaginal discharge, meaning what, and now, the vaginal discharge is dependent on your hormone level, so it cycles through your cycle. So typically, usually right after your period, it's like thick, sticky yellow, and and I'm talking like pale yellow, like egg yolk yellow. That's an abnormal color, okay? And then it's typically around ovulation, if you're not on contraception, if you're not on hormonal contraception, okay? Because if you're on hormonal contraception, it's a totally different story. But you're el natural, usually around ovulation, because the body, like Amanda said, pregnancy is a common occurrence. Okay, your body, the girl's body, is trying to get pregnant every single month. It is setting up an environment that is ideal for pregnancy. That's what our bodies are trying to do. So we can't be surprised if we get get pregnant if we have sex. But one of those things that it does is it thins out that vaginal mucus. It gets like watery, real clear and stringy. That is so that it's kind of loosening that cervical mucus, allowing the sperm to get through. Then typically it'll kind of go back as your estrogen levels kind of drop, and then progesterone becomes the primary hormone. You'll get back to that thick, sticky. So that's normal, okay? But if you have a change in your vaginal discharge, it becomes a funky color, okay? So like green, gray, foamy, or like a thick egg yolk yellow. Or you have a change in your vaginal odor. Every woman has a scent, okay? And like you need to take a shower, you worked out, you've been sitting in your sweaty underwear, we call that swamp ass, okay? But you just, things are a little dirty, okay? So you take a shower, you clean yourself up, but everyone has their normal smell, okay? But that changes, and it's a smell that you're not used to. That I would say is abnormal and needs to be checked out. Typically, you will have these other symptoms as well, or itching or burning. Itching or burning at the vagina is a sign that there might be an STD, or it could be a yeast infection, which is not sexually transmitted as well, or BV, which is some BV is sexually transmitted, but some is not. But once again, I feel like I have to say, to think that you have to have those symptoms to have an STD goes against all the statistics that we have. Okay, so that's why, like back when I took sex ed in high school, you just had you had textbooks that were full of like nasty penises and vaginas, and what that did was teach people that someone has to look like that to have an STD, and that's just not the case. If that were the case, we wouldn't have any STDs, right? Because I'm not having sex with you, it looks like your penis is falling off, right? That's not how it looks. They look very normal, and even like a nurse like myself with lots of training, I can even do a vaginal exam on a girl and be like, I don't think she has anything, and she comes back with something. So don't wait for symptoms. Take the CDC's recommendation. If you're having sex, you need to be tested at least every 6 months or every time you have a new partner.
I have a question that also pertains to this conversation. Can we talk about how STI testing is done, both male and female?
Depends on the clinic. The standard is a dirty urine catch. So meaning you've probably been to the doctor, maybe you have, if you thought you had a UTI and they make you wipe off your penis or spread your labia and wipe with these special wipes. Those are called clean catch urines. But for STD testing, we do a dirty catch, which means you straight up pee in a cup, okay? Now, at Park Ridge, we also, it's a nurse-patient consultation. If there are things that are going on that make us think you're at risk for certain STDs, or you haven't had a pap smear and you're over 21 and you're sexually active, then we would do your STD testing with your pap smear, because that's the standard of care, is that you would get a pap smear once you become sexually active or once you're 21, okay? For guys, most of the time it's just a dirty urine catch. However, there are some clinics that still do the Q-tip in the penis, okay? That's not the standard. The standard is you just pee in a cup, and they send it to the lab, and they tell you what you have. Now, things like HIV, you would need a blood test. That is done with a venipuncture in your arm, a blood test. There actually are some saliva HIV tests now, too. The efficacy is kind of questionable, so really the standard still is blood.
Real quick, I just want to reiterate how important it is to take care of your sexual health. A lot of times we tend to ignore it and just go, oh, it's fine, it's fine, it's fine. And we don't go until something's wrong. But you should go to regular checkups. You should get tested for STIs regularly. So do the checkups and be proactive in your sexual health.
Yeah, we should call it sick care, right? Not health care. Right? So one other thing about scent, though, because I love talking about gender. That's one of the things that I really enjoy. So these social norms of that women smell, vagina smells. If you've rolled out all of these medical things and somebody doesn't like your smell's not really going to change. I would change them. I would find a different partner who celebrates you for all that you are and all of your bouquets.
Nice. Okay, next question. How small is too small for a penis?
How big is too big? I guess. So a lot of guys worry about their penis size. Guys tend to worry more about penis size than other folks. We tend to be insecure about it. And generally we think it's too small, even if it's plenty big. It takes about 2 inches to stimulate. A lot of people want more than that. There are lots of devices, right, that can be used if you feel too small or if you feel that your partner is too big as well. So that is all. They said beauty is in the eye of the beholder, so this would be in the eye of the penis holder, I guess. So again, if somebody doesn't like your size, there are size queens who want a 10-inch penis, which are pretty rare. Most between 5.5, 6.5 inches. So if you're rocking about 6 inches, then you're solid. But some people, both men, women, non-binary individuals, want less than that. So it's all about your partner and comfort.
All right, drum roll please for the next. How many do we have left? Is this the last one? Number 5, we have one more. Okay. Oh, 5, 3, 4, 5. Woo! This table over here. Nice. Winning.
Did y'all pay somebody off? Well, under the
I'm
table?
not supposed to talk about it.
Don't worry about it.
Forget about it.
All right, next question. This one is a little deep. My father sexually assaulted me when I was 13 and told me that it was normal. I did consent to it, but since I was 13, can I still report this or is it too late?
Yeah, you can't consent to that.
No, you cannot consent, and to get a little bit out of the legality of this, that's not your fault. So legally, no, you can't consent, but just on a moral standpoint, that's not your fault. You did nothing wrong. So to say you consented is not true, but that, I guess, guilt, for lack of a better word, that comes with the fact that you didn't say no. You're a child. At that moment, you were a child, and it was that adult's responsibility to be an adult and to not do the wrong thing and harm a child. On the legal side of things, yes, you can report that.
I want to talk a little bit about the psychological effect of our obedience to authority. And so we are trained from a very young age in our society to respect our authority and to not go against what those in authority say and do. And so again, like Nick said, not your fault. You weren't able to consent physically, emotionally, mentally because you were a minor. But I do want to let you know, again, we've got resources because that is a really difficult psychological, mental, and emotional thing to go through. And you do not have to go through it alone.
Thanks so much. That's a great question. We do want to plug for the counseling center. We have licensed professional counselors, free to you. So in the community, you're looking at $125, $150 a session. It's free to you as a student. And so if you have things that you need to process, if this conversation is bringing up anything that you want to talk about or process, let us know, and we can get you connected, okay? Okay, next question, should you choose to answer it, is can you get any kind of STDs from outside stuff or kissing?
So STDs are defined as infections that result from contact with someone else's genitals, okay? So however that might be, we don't consider STDs being transmitted by kissing. Now, things like herpes can be transmitted through oral contact, mouth-to-mouth contact. We would not consider that an STD because it wasn't obtained by, and I say STD, STI, same thing, potato, potato, they mean the same thing, okay? So no, from kissing, we would not consider that an STD. Now, mouth to genital contact can result in STDs. You can transmit oral herpes or fever blisters, canker sores, if it's the herpes virus, which is very contagious, okay? It can be transmitted to the genital area and vice versa. Type 1 prefers the ganglia or the nerve roots in the genitals. Type 1 typically prefers the mouth, but they can be interchanged through contact. So now from outer course, if there is contact with something wet, you can get sick, okay? So vaginal secretions, anal secretions, semen, yes, now if like, I've had situations where like a girl I told Amanda I haven't got to say the word ejaculate, so I'm gonna just say it, okay? If you had an ejaculant, so cum or semen, outside on your vagina, the chances of you getting pregnant are slim to none. Okay, that really needs to be deposited in the posterior fornix of the cervix. But you could, since you had contact of something wet from someone else on a mucous membrane of your body, yes, you could. Also, things like HPV, the human papillomavirus, is transmitted from skin-to-skin contact, and so is herpes. So there doesn't have to be anything wet, okay? You can just be rubbing up on each other's genitals and end up with an STD. Not as common as penetration, but can be transmitted that way. You cannot get it from a toilet seat, okay? So if your boyfriend, your girlfriend be telling you they be getting chlamydia from a toilet seat, they are lying, okay? There is another penis or vagina involved somewhere. Okay, these things don't just miraculously appear. I had a patient one time, her boyfriend convinced her that he gave her chlamydia because he doesn't take a shower after they have sex. That's not true. You're being lied to, okay? So if you're okay with an open relationship, that's your business, right? But if you're not, I think this goes back to like, is that part of the boundaries that you set and the agreement that you had, okay? So if you are not having sex with other people and STDs keep popping up into your life, right? He or she is having contact with someone else's penis or vagina. It's just pretty much that simple.
Only you know if you are in a monogamous relationship, right? You don't absolutely know what your partner's in. Smoking the bear.
That's funny. Okay, the next question is kind of two-part the same, okay? So, what time of the month related to the period can a girl get pregnant? And can you get pregnant while on your period, or is it safe to have sex on your period?
Okay, I think a common misconception is that a woman thinks if she's bleeding from her vagina, she's on her period, and that's not necessarily the case. Periods are a cycle, okay? So if you're having a period related to a normal cycle, so normal, quote unquote, is a period at least once a month, okay? The average is 26 to 28 days, okay? So if it's time for your period and you're bleeding, if it looks like a cat and it acts like a cat, it's probably a cat, right? So that we would assume is your period, right? So can you get pregnant when you're on your actual period? No, okay? Now, can you be having vaginal bleeding for other reasons that are not related to your progesterone falling? Because that's what initiates a period. I'm trying not to get too complicated, but I love this stuff, okay? So that's what ejaculate. Amanda said, say it one more time, okay? But when your progesterone falls, because your egg is ovulated and it's like looking for some sperm, it's running down the little fallopian tube, and if it doesn't get pregnant, it stops sending a signal to something in your ovary called a corpus luteum cyst. Okay, and then when that sucker dies, your progesterone level goes, and that's what makes you have a period. Okay, now if you're bleeding for other reasons, and it's very common to have breakthrough bleeding in the middle of your cycle, especially if you're new to having periods or you're towards the end, like menopausal, your cycles are not super regular. Okay, then you can be having bleeding for other reasons, and you actually have an egg that's an ovum that's been ovulated and can be fertilized. Okay, so the textbook says that you should ovulate about halfway through your cycle. So if you have a 26-day cycle, and that's from the beginning of one period till the beginning of the next period. Okay, so day 1 is the first day of your last period. Okay, so usually halfway through. So if you have a 26-day cycle, you're typically ovulating around day 13. If you have a 28-day cycle, you're typically ovulating around day 14. The ovum is only good for about 24 hours once it's ovulated, okay? However, the sperm can live in the woman's body for 3 to 5 days, sometimes even longer. We have some data that's like up to 8 days. Those is like hardcore sperm, okay? It depends on the vaginal pH and a lot of other things, right? But that means that conception and the sperm need to be there in the fallopian tube waiting on the egg. A fertilization should occur in the outer 1/3 of the fallopian tube to technically end in a pregnancy that will implant in the uterus. Okay, so that means sperm needs to have been there before you ovulated. So really, we can only narrow down conception to about a 3-day window. Okay, and that's with an ultrasound dated pregnancy. So all that to say, that's really hard to guess, right? So this is what we call natural family planning, or some people call it the rhythm method. That's a really hard thing to narrow down. It's doable, but it takes a lot of education and a lot of knowledge of your own body. So I would say don't assume just because you're bleeding. And also, like, typical girls are like, well, I had sex on my period. I'm like, girl, don't you know you get a pass on your period? I mean, you get a pass anytime you want to pass. But, you know, like, if that's what you want to do, that's your business, right? But just don't assume that I'm on my period, I can't get pregnant, because the bleeding may not be your period. I hope that's not super confusing. I feel like I need a whiteboard for that
You're
conversation.
great. You're doing so great. So great. I'm kind of proud of you. Okay, drum roll, please. Who's gonna get it? All right. Last 4. 5, 3, 5, 6. Woo! Nice. What'd you get? Man, I still don't know what kind of gift cards they are. All right. So, next question. Can someone be allergic to semen? Who's gonna?
You can be allergic to anything. So yes, I mean you can be allergic to anything. More often than not, it's probably some type of soap or lotion, or if it's a latex condom, you might be allergic to latex. Allergies to latex are no joke. They'll kill you, okay? So if you're having sex with a latex condom and you're noticing that you're having redness, swelling, itching at the site wherever it was that you had contact with the latex, you really need to find an alternative method. Latex allergies, like the scariest situation I ever had as a nurse was a girl with a latex allergy. We didn't find it out, she was in surgery. Okay, so it's not cool. There are other types of condoms. There's polyurethane condoms. Those are probably the most common that you can find. They are more expensive, but I mean, I would say you can be allergic to semen, but it's probably something else. The immune system's a crazy thing. It can react to a lot of different things, a lot of different ways. So, yeah, yes.
All right. The next question is, I gotta get in line. What is the right way to prepare for anal?
Anal sex is a preference. It is not necessarily the way the body is designed. That does not mean you shouldn't do it. That's up to you, okay? It's just more difficult because the anal sphincter is a stronger muscle. there is a risk of tearing and damage. So I would say lubricant, lubricant, lubricant. All right. That is something where if you enjoy it, that's your business. But it's also like, once again, not a requirement. I think sometimes we get tired of vaginal sex, and in the clinic, I feel like that's where a lot of patients I talk to, and I just feel like I should say this, like they feel forced and pressured into that, right? They were okay with vaginal sex, but they're not okay with this, okay? Once again, you can withdraw your consent or set boundaries however you prefer. But if that's your jam and you love it, that's okay. Doesn't mean there's anything wrong with you, okay? There are ways, and for some relationships, that's the only way, okay? So say lubricant, lubricant, lubricant would be my answer, and unless anybody else took it.
So there's a theme that keeps coming up in my head, thinking about Texas Tech fraternity that got shut down a while back, where they had this big party, and really it was this horribly misogynistic thing. But one of the chants that they had was no means yes, and yes means anal. So if she says no, just try harder, right? Like the old summer loving, tell me more, did she put up a fight, right, type stuff. But then if she says yes, that you can do what you want, right? And so I can't talk enough, none of us can talk enough about consent, I don't think. But consent needs to be like, yes, that's what I want, not I guess so, or maybe, or if you want it, right? Like, yes, I want that sex. And if that's the case, get it. Get us more if you want some more.
Okay, so when I'm talking about receptive anal sex, so meaning, I think sometimes you call it the bottom partner or whatever, but you're the one receiving a penis in your anus, okay? That's a tongue twister, right? Penis in the anus. That's receptive anal sex. So receptive anal sex, if the person you're having anal sex with is HIV positive, you're 17 times more likely to get HIV from receptive anal sex than vaginal sex. So I'm not saying don't do it. I'm a big fan of you need to know all the data, right? So it is just more risky you're more likely to contract an STD if the partner has one. Now, one doesn't just spontaneously combust because you have anal sex. Somebody had to be infected. But receptive anal sex is the most risky way to contract HIV. So be sure that you're aware of that. Condoms were never really FDA approved for anal sex. That doesn't mean you shouldn't use them. You should, right? But once again, I'm going to head right back into get tested. Be honest with your provider, because if you're having anal sex, a dirty urine catch is not going to pick up an anal STD. You're going to need some type of anal swab. Those are not horrible, okay? And so just be honest with your healthcare provider where you're receiving sex so that they know the best way to test you and then treat you.
So also thinking about foreplay, just with thinking about vaginismus, right? There are medical devices that are essentially small dildos that you start with something smaller than what you're going to want to end up with, right? That way you're knocking on the door, and we're opening the door slowly, as opposed to kicking in the door, because then we start talking about some other potential medical issues as well, that you do not want to have to go to the hospital for.
Awesome, thanks so much. Okay, next question. What if the person lies about their age?
You need the black light?
Yeah. That is a very important question, kind of a difficult question to answer because it's hard to say it, but the responsibility is on you to make sure that that person is of age. Because just because somebody lied about that and was underage and you had intercourse with them, you're still going to be responsible. And that's how it's going to be viewed in a court. Everything is open to court interpretation with that. That's all up to judge, jury, and all that stuff. But in the eyes of the law, the actor that committed that offense is responsible to determine the age of that individual.
Every time you grab that, I think you're about to say something.
Oh, I'm sorry. I have nothing else to say on this.
questions and then 2 more giveaways. And then I'm going to ask the panel to just give a short, kind of wrap up what they want to leave you with, okay? All right. Are y'all having fun? Is this helpful? Woo! Can we give the panel one more round of applause? Yeah! Okay. So this question says, what do you do when you don't want the person you had sex with to still be in your house? Meaning you about to get caught, right?
Wow. I think that's multifaceted, right? Yeah. I gotta default back to communication, right? If it was a one and done, get out the door, set that expectation in advance. Be open and communicate. If you are just about to get caught cheating, I think that's on you to face those consequences, take some accountability for those actions. But again, communication is key. If you don't want that person hanging around, make that clear. Some people aren't cuddlers, and that's okay.
I'm going to add, I'm not on the panel, but I'm the MC with a mic, so. Okay, I do want to add, also, if they're just overstaying their welcome, if you have had sex and you're ready for them to leave and they're not leaving, it's okay to, again, communication and boundaries, right? But it's okay to be straightforward.
If we're getting into a situation that somebody won't leave, that, this is, you've indicated that you want this to be over, and you want them to leave your house or wherever you are that you have control over, and they're just refusing to do that. Again, safety first, rather than deal with a volatile situation physically or contact police in that moment where it might be dangerous for you because this person is not going to allow that. Get out of that situation. I would much rather you leave your residence, and unfortunately I know they're alone in your residence, but I'd rather you get somewhere that's safe with people that will keep you safe, and then contact police and say that there is somebody unwanted in my home. Yes, Miranda brought up the Campus Shield app that we have, and familiarize yourself with any safety apps for any organization that you frequent, because they may have their own. But here at SPC, we have something called Campus Shield that you can download for free from your app store. And when you download that, it'll give you a lot of safety resources, everything from information to just different ways to contact law enforcement and assistance that can be anonymous. There's some emergency slider buttons that you can press that will automatically initiate a phone call with campus police depending on what campus you're on, and will give them your location. There's also a really neat feature there that I like a lot that's called Friend Watch, and that will allow you, if for any reason you want somebody to keep tabs on your safety, and maybe you don't want to call the police and say, hey, I'm going to invite a friend over, and if I don't call you in an hour, then something's wrong. But you may want to let a friend know that you're going to, and it doesn't have to be a sexual activity, it can be that you're going to Walmart for 30 minutes. But for whatever reason, if you think there's some reason someone needs to know that you're safe, you can set a timer that if you don't check in with that friend within that timer, or turn that timer off with a pin that only you know, then it's going to alert your friend that you need assistance, and it'll give them your location. So that is a very useful feature that you can access as well.
Awesome. Thanks so much. Last question. Where can I get cheap condoms?
We have them in Health and Wellness for free.
Now, let's take a step back and analyze this question. Is that the time you want to be penny pinching, right? Is that you're like, I really want the bottom of the barrel protection here, right? Yeah, so if you're going to the store and you're thinking, I've only got like $3.50, right? Then, yes, so I have them in my office and in my classrooms. I carry around a bowl of candy and condoms and SPC stickers, and sometimes bookmarks from the library, because this is some of the services that we provide at SPC. Health and Wellness has a box outside of their office and you can go by there and you can like dun 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 dun. You can do it all undercover like. And then I think we should be getting one outside of Lubbock Health and Wellness as well, and that will be outside of the office. And then there are some located in Health and Wellness at the downtown center also. Yes, so free. The health department, I go get cases from the health department. Now y'all ain't special like that because you don't teach human sexuality. I get 2,000 at a time, just to give away, But the health department and South Plains Rural Health as well, Star Care in Lubbock also. So there's quite a few places. My brother used to go get free ones and then sell them to his homeboys. He had a side hustle selling free condoms. It was great.
That's awesome. Okay, drum roll, please. 2. We got 2. The first one goes to 5363. Anybody? Anybody? No? Yes? Woo! All right, number 2, drum roll, please. Goes to 5361. Anybody? 5361. No? We'll draw again. Drum roll, please. Woo. All right. 5373. Anybody? Woo! Yeah. All right. Thank you all so much for being here. We just want to take one more round, and I would like to ask the panelists if there is something that you thought, like, I would like to share that. We want to pass the mic one more time down the line and just share any last thoughts to wrap up.
I left a set of cards on each of the table from Park Ridge, and there's a little one that has a QR code, our list of services. If we can ever help, please just let us know. It's easy to make an appointment with us for pregnancy testing, STD testing, counseling. We also offer post-abortion support. So if that's a part of your story or someone you know might need help kind of processing through that previous decision, that's also an area of help that we can provide. And everything that we offer to you at Park Ridge is free. There's never a need for you to pay or insurance or anything like that. We're just here to help if we can. So here's my parting.
I would say the things that are popping into my mind is, obviously from our talks here, sex is complicated, right? Because we're complicated people. We're complicated beings. And so I think one of the things I learned sitting across from mostly women, but some guys, who were in sexual issues related to sex that they didn't want to be in, whether that was they're worried about they had some type of STD, or they thought they might be in an unplanned pregnancy. It was that there is a lot involved to sexual choices. So I would say educate yourself, find people in your life that will help you reach your goals, and set boundaries. Set boundaries early, and do not feel like you have to change your boundaries. Also, the myth that sex is just physical. There are emotions involved, okay? We're not, just some cows out in the field having sex with each other, right? So that's why, I remember I was a fairly promiscuous teenager because of a passive sexual abuse, but I remember that awkward feeling when you saw somebody, and I'm like, that proves right there that my emotions are getting involved, even if I don't want it to, okay? So be aware of that, right? There are things happening in our brain that are bonding us to people, and we can't necessarily shut that off just because we don't want it to happen. So I deal with a lot of girls who have major anxiety or depression because of their sexual choices. And I wish we could remove the shame around that, but know that is, if you're feeling like this is hurting me in ways that are not physical, that is normal, okay? And I have a teenage daughter who's a freshman in college, and I've told her this since she was big enough to talk about sex, which at our house was 3rd grade, okay? Sex should make your life better, not more complicated. So if it's making your life more complicated, maybe it's not the right season or the right person.
Yeah, and I want to reiterate, yes, sex is complicated, and there's a lot of variables at play, and I just want to remind you that consent is important. Giving consent and then accepting consent, right? No is a complete sentence with no excuses or reasons or anything, just no is okay. It's not impolite, and that your feelings matter just as much as your partner's. So if you're feeling uncomfortable with something, communicate that with your partner. Learn to communicate with your partner. If communication is something that you are not strong in and it's not something that you're comfortable with, again, we've got counselors for free on campus because sometimes we don't have those skills naturally, and it's something we need to practice and work on. So use your resources, your local community resources, your campus resources, and your biggest resources is your people and your connections that you make.
I want to utilize some of the things that you said with if something's not feeling right, and talk about sexual assault, because that is a question that comes up a lot is, how do I know if I've been sexually assaulted? And I think it's really important to talk about two aspects of that. Number one, the sexual assault in the eyes of the law, or rather what that sexual activity that occurred means in the eyes of the law, and what that sexual activity that occurred means to you. Just because something may not legally be a sexual assault does not mean that that should discourage you from making sure you have a voice and getting resources that you might need, because there are other elements to not only sexual crimes, but just again to what that meant to you. So in the eyes of the law, Texas law, sexual assault has to have a penetration occur. So we have to have a sexual act in which an actor forced somebody to penetrate a sexual organ of another, or force the penetration of the sexual organ of another, or the other way around. But there are other sexual misconduct laws, such as indecent assault, which is where there is no penetration, but there is sexual contact. Those are some recent laws where before they would say, well, there was no penetration, so it's not sexual assault, be on your way. Well, now just the groping, fondling of genitals is a criminal offense. It may not be sexual assault, so it may not be that case. But as far as what you may need, it may be the same thing. You may need those same resources, and you may need that advocacy and help. So if something doesn't feel right, it's probably not right. So assess that situation and deal with it the way that you need to, and come forward to whoever that needs to be for you. Your counselors at this school are a great resource because they are anonymous. They're not going to take that forward with anybody, but they can get you those resources that you need and help you out along your journey with whatever that means for you. If that looks like filing a police report, they can help with that. And if that looks like just being that person to tell you where to get those resources, then they can do that for you too. But if you're struggling with that question at all, did something happen to me that shouldn't have happened? If you're struggling with it, listen to that internal struggle. She said, mention you can't consent if you're drinking. So there's a whole list of things that the Texas Penal Code would say. It counts as without consent if these things are present, and one of them is if that actor was aware that that person could not give consent because of their state of being in that moment. So if they are intoxicated and the actor knows that that person's intoxicated, then that is a sexual assault because you couldn't consent in that moment. So there's a lot of things that come with that at an investigation that you may not think about, because you go, well, how do they know that this person was intoxicated to a degree that they couldn't consent? If someone's taking care of you because you're intoxicated they should know that you're intoxicated to a level that you can't consent. So that, let me take care of you, I'll make sure you get a ride home, I'll hold your hair back while you're puking, that's an extreme, but if someone's taking care of you because you can't take care of yourself, you can't consent.
If a person could not drink tea or Dr. Pepper in that situation, then they cannot consent. Right? That's one of my favorite videos is about the drinking tea video. So like if they're asleep, right? Yeah, do it. Okay. See services. There was a time when I went and filled out a report with Nick. Right? I experienced some violence as well, and Nick was there. So I think it's important to put a face on things, especially as somebody who's male, because male assaults are very underreported. So know that we have support, and there's all kinds of resources for LGBT folks, for women, for men, for children, for the elderly, right, who experience sexual assault. And I want to kind of take this in a different direction too. In terms of truth, like our truths, be honest with yourself first and foremost, right, about what you're comfortable with, what you want, who you are. But the thing is, we're on journeys, right? Whether it's our journey of understanding how gender works in our life, how sex works, what we're into, what we don't like, what we only like in certain situations. It's all a journey, right? So finding your truth is very important. And when somebody else shares their truth with you, that's also very important. Think about here in West Texas, just in Texas in general, right, with laws and all kinds of social norms against LGBT folks, right? If somebody comes out to you, that's an honor, right? That's a respect and that they've given you in terms of they can trust you. And so this is my tag phrase that I'm going to end with that I've used before, is that the difference between living your truth and living a lie can be the difference between wanting to live and wanting to die. Okay? So know your truth. Celebrate other people's truth when it's worth celebrating, right? And love each other. Act with love. Act with love. Okay.
Awesome. Thank y'all so much for being here. Thanks for the panelists. Thanks for this open discussion. We appreciate you guys for being here. Brent has one more thing.
One more thing. I teach human sexuality. And that class, I used to teach it every semester, and it used to be required by nursing, but then for some reason the state decided that maybe we needed to change requirements and things. So then it was teach it every other semester, and now it's like every couple of years I get to teach that face-to-face. So I'm going to have that on the books at the downtown center face-to-face for the spring semester. And then I also teach it online, usually every other semester. So that's a great class, and I have never, ever had a student tell me, like in algebra, right, what's the big question for your professors in algebra? Am I ever going to use this? In the human sexuality class, it's, when do I get to use this? Right, okay.
All right, thanks guys for being here. We appreciate you. Have a good rest of your night. Take whatever you want off the table. It's yours.
And I have some business cards too. If you need business cards, you want to take a class, shameless